Medicine Monday, where the aim is to educate, empower and equip you with the knowledge that you need to live your healthiest life. Today we're talking all about migraines. So migraines, these are very common headaches. You've probably heard a lot about them before and you may even experience them yourself. 1 in 5 women are affected by migraines and 1 in 15 men. So you probably have come across it before. Now, a migraine is a type of headache that usually starts in early adulthood, and it's something that often affects people for the rest of their lives. The frequency of a migraine or a headache attack like this really varies from person to person, but there is usually a pattern to the kind of headache people experience. So a migraine is usually a moderate to severe headache. It's not usually something mild and something that's just niggling in the background and can be ignored. It is something that really does affect people from day to day. You'll see a lot of people having to take time off work when they get these horrible migraine attacks. Now, not only is it this moderate severe headache, it also has a certain characteristic to it. It's usually throbbing in nature and it often affects one side of the head. Along with the headache and this pain, there's also other symptoms such as nausea, vomiting, having a more sensitivity to light and to sound, and also some people even experience some stomach pains that come along with it too. The reason why I wanted to do this video today is because although migraine is a very common type of headache, a lot of people don't know enough about it. I always meet patients that tell me they're having migraines, but after we delve into it a bit more, I find out that it's not a migraine at all, and it's just more of a tension type of headache. Also, there's lots of people that aren't managing their migraines very well, and so this video is here to give you a little bit more information so that hopefully you can get on top of these migraines if you are experiencing them. The key to managing migraines are knowing your triggers. Now, most migraines, they don't come on out of nowhere. Sometimes it might feel like that, but migraines usually have a trigger. And if you can spend some time finding out what your triggers are for your migraines, really you're ahead of the game. You're one step in front, and you can actually find yourself being able to manage these migraines so much better, and not having them being so debilitating and affecting so much of your life like I know they do for a lot of people. So to make these triggers a bit easier to remember, I split them into 6 categories. The first one is hormonal, and this usually happens with women in relation to their period. Some people experience a migraine from 2 days before a period to 3 days afterwards. If you only ever get migraines during your period, those are known as cyclical migraines. But if you find that your period is just a trigger, but you get them at other times as well, then that's just another trigger that you should be aware of. So the second one is environmental triggers. Now, you might find that when you're looking at a computer screen or a phone screen for long periods of time, that triggers a migraine for you. But also, other types of bright lights can be a trigger. Loud noises, very strong smells, if you're in a stuffy or a smoky room can trigger it too, or if there's a sudden climate change, you've gone somewhere that's very cold or very hot, they can trigger migraines for some people. The third type of trigger is an emotional trigger. Whether that's stress or anxiety, shock, excitement, any heightened stage of or emotional state can cause a headache or a migraine to be triggered. Number 4 is physical factors. There really is a big range of triggers that come under this category, but some examples are tiredness, if you've had a lack of sleep, if you're jet lagged or you're a shift worker can sometimes trigger it for some people. Also, if you're finding yourself having a lot of tension in your neck and shoulders can trigger it on for some people, and even poor posture. Number 5 is all about your diet. Whether it's that you've missed a meal that's caused it, or if there's actually a particular food that is bringing on your headache. Some very notorious ones for bringing on headaches for people are alcohol, caffeine, chocolate, citrus fruits and cheese are also ones. And in addition to that, foods that have a substance called tyramine in it are known to give people headaches. So make sure you have a look at your food, the packaging that you buy, and see if it does have that ingredient, and maybe that's one of the triggers for you. And number 6, the final trigger category is all about medications. There are some medications that people have that they'll find that once they start them, they start getting more migraines than they had before. Some ones that are very common culprits are sleeping tablets, which is just, and this causing migraines is another reason why I really do not like sleeping tablets at all, and I try my hardest not to prescribe any for any of my patients. There's so many issues with them, but causing migraines is one of them. Also, hormonal tablets, so hormone replacement therapy that's used in menopause, that can also cause some issues with migraines. And also the combined oral contraceptive pill, a lot of you would just know it as the pill that you take for contraception. That one, it's really important to have a clear history of your migraines if you are going to be using that pill. As not only can it sometimes trigger or worsen migraines for some people, it can also increase your risk of having a stroke whilst on the pill if you are someone that has migraines, but not just any type of migraines with aura. So you might be thinking, how do I actually find out what my triggers are? Sometimes it's very obvious for people, but often it needs a bit more work. And this is where you can start taking control of your own health. The best thing to do is to keep something called a headache diary. Now, a headache diary is just a log, very simple, that you use to document all of the headaches that you get. If you can keep in the diary a note of the time and day that happened, what you were doing at the time, if you had any symptoms before the headache came on, and what the symptoms of the headache were like. Did you vomit with it? Did you have to lie in a dark room? Also writing there any medications that you use, and also when the headache finished. Getting an idea of that pattern and what kind of headaches you have, you might be able to pinpoint what triggers are for you. Some people do find it hard to keep a headache log, but really putting that work in can help you to manage your headaches so much better. And down in the description box, I've actually done a PDF of a headache log where you can print off as many versions of it as you want, and you can just document in there what headaches you're having, what problems you're having, and then you can either look at it yourself, see if you can figure out what your triggers are, or take it to your GP and look through it with them. Now, just a minute ago, I spoke about an aura, headaches with aura or migraine with aura. And actually, whether or not you have this thing called an aura helps us to classify what type of migraine you're having. Now, an aura is basically a warning sign that you might have a headache coming on. These are usually very transient, lasting between 5 minutes and an hour, and they happen just before the migraine starts. Now, what symptoms you have for an aura really depend from person to person, but some common ones are visual changes such as zigzaggy lines across your vision or some kind of blurring. Some people also get pins and needles with it, and even people have reported having difficulty with speech as well. But it is transient, it does get better, and it's usually followed by your migraines, and you'll notice a pattern if you're having that. Now, not every headache does have aura, and that's how we classify it, like I said. There is migraine with aura, migraine without aura, and some people just get the aura without a migraine at all, without the headache. And when people are just getting aura, that can be very difficult to diagnose, as I'm sure you can imagine. Now, in addition to having this aura for some people, before a headache, some people get pre-headache symptoms too. And that can last for hours to days before you have a migraine event. Now, it really depends, and the symptoms can sometimes be quite vague, but people do report a change in their mood or their energy levels or their appetite in the preceding hours to days, and that can be another warning sign for you to get ready because you might be experiencing a headache soon. Also, usually migraines, they shouldn't be there all the time, of course, and they usually don't stop suddenly. It's usually a gradual change, and often people do describe having a period of tiredness once the headache has moved on. So now you've got a bit more information. You know what a headache is. You know the different types of headache and also the triggers that are associated with it. And you've even kept a headache diary. But do you know how to treat it? A lot of migraines can be treated by yourself. They can be managed at home. And this channel is all about empowering you to take control of your own health. So the number one thing is to avoid triggers. It sounds very simple, but there's a lot of people that don't do it. But avoiding triggers is the number one thing. And if there's a trigger that you can't avoid, such as your period, try to prepare for that time when you know that headache is going to come on. Now, the other way is that you can manage it yourself as well. And if you have migraines, you've probably already tried this, but it's lying in a dark, quiet room. Often that can reduce down the amount of stimulus that you're having and give your body a chance to recover itself. Some people report that just having a nap or a sleep can really help, and that when they wake up, their migraines are often gone. Now, if you imagine every time you get a migraine, you're having to go and lie down in a dark room, this explains why so many people aren't able to work or do anything whilst they're having a migraine. In addition to avoiding your triggers and lying down in a dark and quiet room, there are also simple painkillers that you can take for migraines. These include paracetamol, ibuprofen and aspirin. And as long as you don't have any other health problems or any reasons for not taking these medications, they're very good ones for you to buy over the counter yourself and see if they are effective in treating your headache. There is something to say though about taking too many painkillers. There is this phenomenon called medication overuse headaches. And some people, if they are taking painkillers on a regular basis for more than 10 days a month, people can start to experience headaches, but that's due to the medication they're taking. It's a really difficult concept to come to terms with, especially when you're having headaches. But if you're taking painkillers long term and you suddenly start developing these headaches that aren't shifting, actually getting rid of your painkillers and having a period of time without it can often be the best thing for you. Now, of course, I said that you can manage these at home, but there are lots of people who struggle with that. And the time to come to see your GP is when the home treatments or the self-management isn't working, or if you're getting very severe headaches. And even if you're not getting very severe migraines and the treatment you're using at home does work, if you're having a migraine more than 5 times a month, that's known as quite a high frequency of migraines, and that's when you should be coming to see your GP as well. The things that your GP can do are actually start you on some medication to treat the episode of migraine when it comes on. And the mainstay of treatment, in addition to the paracetamol, ibuprofen and aspirin, are something called triptans, which are drugs that are very good for treating migraines. The important thing to do for any of these treatments that you use when you're getting a headache, that includes the simple painkillers or the triptans, is to take it at the first sign of a headache. Do not wait until your migraine gets to its peak before you take the medication, because often then it's not as effective. In addition to treating with triptans, your doctor can also start you on some medication to prevent you from having migraines. There are actually 3 different drugs that can be used, and if you go to your GP and explore that with them and you're having migraines frequently, more than 5 times a month, these medications can be trialled to see if we can get you headache free, or as close to it as possible. In addition to medications to manage your migraines, we can also look at some more alternative therapies. And for example, acupuncture has been found to be quite effective in the treatment of migraines. Now, you can't get acupuncture on the NHS in most places, but there are a few areas in the UK that are offering this. But if you do have the means yourself to fund it, you can explore some acupuncture and see if that treatment is something that would help you. Now, although your doctor does have all these different medications at their fingertips to give to you to try and treat your headaches, often the best course of action is still to keep a headache diary, still to find out what your triggers are and to treat it in a more conservative way. Medications, they all come along with different side effects, and if they're needed and the benefits of them outweigh the risk, then of course use them. But really taking time to understand your body more is the best course of action here. So you may find yourself that you've seen your GP, you've tried some different medications, even some things to try to prevent yourself from getting migraines, and it still isn't working. At that point, your GP may offer you a referral to a neurologist. And just so you know when a referral might be needed, there are 3 main occasions. First is when the diagnosis is unclear. Maybe you're having not quite typical migraines and it's not responding to treatment, and they need some more help in actually diagnosing what the problem is. The second thing, maybe if you're having what we call a chronic migraine, a migraine that's lasting more than 15 days and isn't getting any better, that'll be a time to refer. And the third one is if you're having treatment with the GP and it's not working. Now, this video, I've tried to put as much information as I can about migraines in here, just so that you have a bit more knowledge about how you can manage them yourself. Remember, the number one thing that I want you to take away with you today is to keep a headache diary and find out what your triggers are. Once you know that, you really are ahead of the game. So I hope this video was useful. If you have any other topics that you'd like me to talk about, any questions, anything at all, please leave them down below and I'll see you next time.